Well, ketamine clinics have been growing in popularity, but after the death of celebrity Matthew Perry, there's been a lot of questions about whether ketamine is safe. So we're taking a deeper look.
Honestly, most of my life, I can remember experiencing feelings of depression, but pretty intensely since I had children.
Stephanie says her depression was so heavy she couldn't be fully present with her kids. She asked we not use her last name.
My depression was impacting my relationships in a way that I was not happy.
She tried other antidepressants that increase serotonin in the brain.
Would get some relief, but just never quite got to where I really wanted to be.
Then 3 years ago, she found ketamine therapy.
When you go through a session, what is it like? Like, what's going through your mind? I was kind of told it's a little bit of an out-of-body experience.
Mm-hmm.
Can you describe that?
It is a little bit of an out-of-body experience. However, I will say I'm always very aware that I'm having an experience. I've never felt afraid or that I get out of touch with myself.
Stephanie says her therapist is with her for every session.
It's a very experiential process, and I felt like it would be even better if I could go over that with someone trusted, with a professional who was already familiar with me.
Stephanie has been seeing certified nurse practitioner Keith Paris. He co-owns Hydrate Medical in Asheville and Derive Health in Charlotte.
Have you ever had anyone who had a bad experience taking ketamine in front of you?
No.
Really?
Yes. People use the term bad trip. People have a bad trip when they take a mind-altering drug and they're in a club with 1,000 people they don't know. We provide a setting where they're medically safe, they're supported by staff, they're in a comfortable room, and, supported throughout their whole treatment.
I also asked Paris about the recent death of actor Matthew Perry and how he ensures patients at his clinic are safe.
Well, the first thing that happens is the ketamine is only administered by a provider, a physician, nurse practitioner, or a PA who's had specific training.
Paris says in the case of Matthew Perry, he obtained ketamine illegally and took a high amount of the drug with no supervision.
And according to the court documents, his assistant, who had no medical training at all, was administering this drug. He gave him the drug and then left him alone in a hot tub or a whirlpool.
Do you think for anyone this could become addictive for them if they might crave it outside of the clinical setting?
I can speak for myself that I never have. I have never felt a craving for it.
Since taking ketamine, Stephanie says both she and her kids have noticed a big difference in her mental health.
That was most encouraging for me, is to see the positive input that I've gotten from my family and the happiness that they have for how they see it's impacted my life in a way that has brought me a lot of happiness and satisfaction and given me a lot of hope.
Now, it's important to note that ketamine is an off-label drug at most clinics. So this means it's not FDA approved to be used in this way, but it is allowed.
Even though it is off-label, does this treatment, is it covered by insurance at all?
Well, because it's off-label, it's not covered by insurance. So you do have to pay a pretty hefty price. It's about $400 a session. And usually to start, you need about 6 sessions. So that adds up very quickly. And I asked the doctor about this, and he said, well, for some, it's worth it for their health because nothing else has worked so far.
Right. They're willing to pay the hefty amount, get that relief. And what's already available out there when it comes to ketamine?
So there's what's called S-ketamine. It's Spravato. So this is an FDA-approved medication. It's a nasal spray that you spray up your nose, and so it's kind of a form of ketamine, but in a different, a different application. And so this would be something that's possibly covered by your insurance. So would be possibly a more affordable option for some people. I did ask the doctor here why he doesn't prescribe this, and he said he thinks it's not as effective because it's a nasal spray, whereas with the ketamine you actually get it in an IV that goes directly into your body. So he thought that was a little more effective, but different options for people out there.
Okay, whole lot of treatment